Kia ora, good afternoon, welcome back. Well, the mongrel mob has confirmed today that a couple of the gang's members or associates have been caught up in the current COVID outbreak. So a woman who later discharged herself from Middlemore Hospital tested positive for the virus. She lives at the gang pad. And another mongrel mob member who also lives at the gang pad has now tested positive. So mobile testing units have been going around to gang associate houses to test close contacts, according to the mongrel mob. Chris Hipkins is the COVID minister with us now. Afternoon, Minister.
Good afternoon.
Right, so we've got this woman who's positive. We've got another gang member positive. Anyone else who's tested positive in the gangs?
Look, I want to be clear about this and stay consistent. We don't release details about people unless there's a public health rationale to do that.
But we've already got it, right?
Well, they chose to release it. That's their call, but we don't release that information.
Okay. We're hearing that you're trying to track down maybe even more than 50 gang members to test them. Is that right?
Look, what I can say about this particular group is that we are seeing really good cooperation. They are working with the relevant health officials to make sure that people who need to be tested are tested, people who need to be contact traced are contact traced.
Are you trying to track down as many as 50?
I don't have a specific number.
How many have you got? What is your not specific number?
Well, no, I don't have that number. That's not a number that's typically shared with us. Obviously, information is shared with us when there's a good reason to, but in terms of the contact tracing, nothing like that has been shared with me.
So if mobile testing units are going from gang house to gang house, that would suggest that they haven't been sticking to their bubble, right?
Look, that's ultimately a question for the contact tracers. I haven't got information on the exact movements of everybody.
Sounds like it though, Minister.
Contact traced. Look, like I said, where there's a good public health reason to share information about people's movements and so on, then we do that.
Are these guys, are you aware of any drugs involved in this? Was that woman addicted to pee?
I haven't got any information on that.
These guys selling drugs?
I don't have any information on that either. I could not give you.
Because I think that's important information that you should probably go away and ask about, because I would suggest that if they're selling drugs or addicted to drugs, it's likely they're going to be breaching their bubbles, right? And then we've got a problem in our hands.
One of the key things here is we're not doing law enforcement here. We're doing COVID-19 contact tracing and testing, and it's really important that we don't blur the two things, because the last thing we want is people to stop cooperating. Now,
I'm not asking you to.
We can all look down on the activities of.
I'm not looking down on it, Minister. Minister, okay. The reason that this is relevant, it's not judgmental in any way, and people can do with their lives what they want to do. But we've spoken to a couple of modelers and epidemiologists who say that this is really concerning, because you don't generally get a lot of compliance from gangs. I mean, they're not known for abiding by the rules, so they're probably breaching their bubbles all the time. And if drugs are involved, it becomes even more problematic, because all of a sudden you've got a vein of networks that are then exposed to COVID, because people, I mean, there's nothing like a drug habit that's going to make them breach their bubbles. So are you concerned about that?
I'm worried about anybody who's breaching their bubble requirements and not following the rules. The feedback that I've had from the contact tracers so far is that the people in this particular sub-cluster are being very cooperative and are working hard to help the contact tracers and to be very cooperative with the work that they are doing.
Last week we asked Aisha Verrill, it was exactly this day last week, do you believe we can get back to zero? And she said, yeah, 2 weeks from now. What do you reckon?
I've never been quite as bold as to put a time frame on these things. I am encouraged by what we're seeing at the moment, which is that, if you look today, we didn't see any mystery cases, so every case was linked. As long as we're seeing the number of cases going down and the number of cases who are identified being people who are already known contacts and already isolating, then, those are encouraging trends.
Are we not just doing the same thing as ACT right now?
We do expect, given the sort of the characteristics of the different subclusters that we're dealing with at the moment, that there will be days where there are blips, where the numbers go up, because we're dealing with, in some cases, quite large households.
But you're fast running out of time, right? Because we're out of level 4 in a week.
But the question really is not so much the numbers, but the characteristics of those numbers. So are they people who are isolating and so on?
Hey, it's great that you're opening up MIQ again, but why can Kiwis in Australia not access it?
At the moment, there's a question of logistics there around scheduling red flights and so on. We are absolutely aware that we need to make some decisions on that. We need to work with the airlines to make sure that there are red flights available for people, and that we're lining up the release of vouchers.
So you will give them an opportunity.
Oh, absolutely, and it's not far off.
Hey, do you need to put your foot down with the unions over the school holidays?
Look, it is a bit more complex than that. Yes, I've heard the feedback, very strong feedback from the teaching community about that. That will be one of the things that we weigh up, but there are other factors there too.
All right. Minister, thank you. Appreciate it. Chris Hipkins, COVID Minister.